Mr. Richmond?
Here.
Ms. Cash?
Here.
Ms. Zipsey? Ms. Miller?
Here.
Ms. Lawley?
Here.
Mr. Bonnell?
Here.
Dr. Zollett?
Here.
Do we have a motion to excuse Ms. Zipsey?
So moved.
Anyone in a second?
Second.
It's properly been moved and seconded. We proceed to vote. All those in favor say yes.
Yes.
And all those opposed say no. The yeses have it. We will excuse Ms. Zipsey from today's meeting. Okay, so the next item on the agenda, did you want to go ahead and?
Well, citizen comments, very few times do we get citizen comments, but sometimes we do. So you can say citizen comments, seeing that there are none, and then just introduce yourself
Okay,
and let
gotcha.
everybody go round robin.
That's what I wanted to know. When did you want to do
good.
that?
I think it's good to do it at this point.
All right, so next item on the agenda is citizen comments. Do we have any? Seeing none, we will proceed to just introductions, quick introductions for the new year. And my name is Elizabeth Stamka. I was elected mayor, and so I'm the new president of the Board of Health. And I'm very grateful for all of you for watching your meetings and learning a lot right along with you. And I'm really excited about being part of this board, this wonderful board. If you ever need me or want to contact me, you can send me an email. I'll be here pretty much every day, just trying to do some work and help. So that's it for me. Thank you.
And start with Dr. Zollett.
Scott Zollett, I'm born and raised here, was on the staff at Atrium and Middletown Hospital forever, and I'm retired, and got talked into being on the board. Here I am.
How long have you been on the board?
This is my second year.
Mhm.
Ruth Lawley, born and raised here. I work in nutrition treatment to outreach. And I've been on the board, I think this is my third year. So,
Emily Miller, I'm a nurse, infection prevention nurse at Atrium. Lived here all my life, and I've been on the board since September.
Jeff Bonnell, I'm the funeral director in Balma.
Shonda Corbin, the director of nursing.
Sally Cash, a retired RN, and Jackie, I have no idea how long ago this was.
1918. Just teasing. Oh, I have it up here. Let's see, Miss Cash. Oh, let's see.
Technically her first
Yeah.
term.
Yeah, well, yeah, technically, but I think you've been on the board for, I'm trying to think, probably at least, 8 years, 10 years? It's probably been, it's been a while.
Yeah,
Mhm.
I love my town.
My name's Joe Richmond. I've been on the board just my second year. I am a group health insurance broker for Health International. And then I have a background in health promotion and exercise science.
This is me, and then behind you is.
I'm Paul Genowine. I am an internist here in town, been here for 26 years, and a medical director for the Board of Health.
Our medical director, and then Chandra, when she said nursing director, that's staff as well. And then you've met Amanda.
I'm Amanda McDonald. I'm the Vital Statistics Registrar in the Environmental Admin. And Carla Ely, Director of Environmental Health. I've been in the city for 20 years.
So, this is your, and when I had met with the mayor, I told her how important it is to have a health board that can really be activated in a time of emergency, using their backgrounds, their skills, and their knowledge. And so that's some of the things that we really like to see when we put out for boards and commission, at least for the health department. And all of them having medical background, addiction and treatment background, infectious disease background, funeral home background. In 9/11, we were really talking about what happens with mass bodies and mass burials. Funeral homes are definitely important in there. At the time when Sally first came on, she was a school nurse. And then she had a background of the office nursing. So you get all of that information regarding health from your community, so you can get that information there. And Joe has the background with insurance and the health side too, so that's good. And then Miss Zipsey, that's not here, she is Power Gym, And then she has that overall physical health piece to the importance of health. And so it's really nice to have a board that if we say we need to set up a clinic, we need to set up something, people have knowledge of, you know, at least the basic knowledge of health, that we could really take our 6 staff and turn it into 16, you know, so I appreciate all of them. Happy New Year as we get started, and feel free at any time to get from us anything you need to, Mayor.
Thank you. I do have a lot of questions, and I'm really excited also about possibilities of health in Middletown. So even with our packet today, I was like, oh, I guess I'll just wait and ask those questions later, just to get some clarification and to find out more. But also just wondering things that we can talk about and in new business and bring up.
Absolutely.
Just very excited about possibilities. So thank you. Thank you. All right. So the next item on the agenda is approval of the minutes from December 12th, 2023 Board of Health meeting. We have a motion to approve the minutes.
So moved.
Do you have a second?
Second.
The motion to approve the minutes has been properly moved and seconded. Is there any discussion? Hearing none, we will proceed to vote. All those in favor of approving the minutes, please say yes.
Yes.
All those opposed, please say no. The yeses have it, and the motion passes. Next item is to receive and file the financial report.
Unfortunately, we have no financial report this month. The city has a new financial reporting system, still getting the kinks out. I think we might be able to start retrieving some expenses, revenue sheets, the basics, but they haven't compiled reports and given them to us, right, yet, Amanda, but we haven't spent any money yet because it's not even open to spend money. So our budget is the same as it was when it was approved at council in December, because we haven't paid any bills yet, so. But hopefully in February, we will be able to have a report. In the packet, we have our just internal report that Nancy does for us on this page that just tells us about, you know, the last month's birth and death certificates sold and how much money we made for there. So this is a basic financial report, but the official one that you're used to seeing is gonna look different, but hopefully we'll get it in February.
Okay.
Does that make sense? Kinda?
How will it be different?
Well, it's a new system, so it was AccuTerm, when we printed it out, it had all of our revenue on pages, our vital stats, our grants, it was all different. Now, this one is supposed to be like a real-time reports, like when it comes in, when the payments come in. It's supposed to be a real-time report. I think it's probably gonna be smaller print, it'll just look a lot different, it's just a complete new system. Yeah, smaller print. Remember that old AccuTerm had it was like a dot matrix report, but it gave you every month how much revenue we brought in. So you had probably about 10 pages worth of revenue from vital stats, FSOs.
So far, they've told me that it's gonna be more of a daily report, and I'm not sure how it's gonna look month over month,
Month
and
over month,
really
yeah.
year over year, cause that old system we had always printed year over year for like the last 5 years, right?
Right.
Comparable, so it was easy to see.
Yes.
So we're really not sure yet.
Yeah, what the reports look like. It was really neat to look at vital stats. You could look at December, and if you had $100, you could look at 2022, and if it was $700, you could see that you were down 600. It had year over year kind of stacked on the paper. Now we don't know what's going on. Because it's a completely different system, as well as Troy's supposed to be building in a piece of this system. So it may be something that our IT department is gonna build into this new accounting system. But we haven't had a report to see what it looks like yet.
Right, and we've been working with them to try to get it, it's just not available.
Acting like the federal government, right? Trying to.
We haven't closed the government yet, but.
Okay, so we will not be receiving and filing a financial report today.
That's correct.
And that's okay. So next on the agenda is our education presentation from Dr. Genowine. Dr. Genowine, you have the floor.
Okay, today we're talking about sleep apnea. Sleep apnea, so essentially apnea is any kind of pause or stop in your breathing. Occurs while you're sleeping. Most of the time patients don't even realize they're doing it because they don't fully wake up. But as a result of that pause, prolonged pause, you get a decrease in your oxygenation, you get an increase in your carbon dioxide. That increase in carbon dioxide, as you get deeper into sleep, everything starts to relax in your body, including the muscles in your airway, and it starts to, in obstructive sleep apnea in particular, it starts to close off the airway. As the CO2 goes up, you actually start to wake up, come out of the deeper sleep into a lighter sleep, everything tightens back up, you start breathing better again, and that just cycles over and over through the night without getting good quality sleep. Two main types of sleep apnea: you have obstructive sleep apnea and central sleep apnea. Central sleep apnea is a problem more from the neurologic side of the brain center, not triggering you to breathe, and then you have mixed, you have people with a little bit of both. So in obstructive sleep apnea, it's the most common form, it's about 85% of sleep apnea. It is, again, an upper airway narrowing while you're sleeping. You have obesity, allergies causing swelling in the airway, or enlarged tonsils or tongue, uvula on the back of the throat, the little thing everybody sees that hangs down. If that airway gets narrowed down, air is not moving through well, and you struggle to get that breath as you sleep. Central sleep apnea, as I mentioned, is a neurologic issue where the brain just is not triggering to take the deep breath or to take the breath at all. This is more typically of childhood. The obstructive sleep apnea is more of adulthood, higher risk of obstructive as you get older. Signs and symptoms, pretty classic ones that we look for: excessive daytime sleepiness. The person comes in talking about easily falling asleep. They sit down anytime they fall asleep. Kind of the classic one is, have you ever fallen asleep at a red light? They're so lacking in really restorative sleep that they can fall asleep quite quickly. Have some similarities to other sleep disorders, but the biggie one is also loud disruptive snoring. So the spouse oftentimes will say they snore like a freight train, and you put those two together, and it's a pretty high likelihood they have some version of sleep apnea. Oftentimes, family members will notice the pause in the breathing. They're actually kind of breathing along nice and methodical and pattern, and then suddenly there's just this stop of the breathing, kind of making some gurgling noises coming with it. Patients will oftentimes complain of waking up morning time headaches, and that they wake up a lot during the night. So their oxygen drops, their CO2 goes up, body wakes up, they realize, boy, I gotta go to the bathroom or whatever. They think they're waking up because they have to urinate a lot, but really it's poor sleep quality that's waking them up. Risk factors: male, it's twice as common in men as in women, 2-to-1 ratio. Obesity is really the big one. For obstructive sleep apnea, being overweight is huge in your risk for obstructive sleep apnea. It's more common as you get older. If you're over 40, it's much more likely, but even then, as you get up in age, the risk increases. Large neck circumference. So it's not just obesity or being overweight. If it's a large guy and they're real muscular and they've got the big, thick neck, greater than 17 inches, that's a risk factor in itself. Family history, particularly if dad had it, you're more at risk. Smoking puts you more at risk. Alcohol just relaxes everything when you're sleeping. So alcohol puts you at increased risk. For central sleep apnea, the big risk factor is premature birth. Greatly increases the risk for the newborn to have sleep apnea. Most central sleep apnea in youth, if it's particularly something like premature birth, they do grow out of it and improve on their own. Diagnosis really is kind of what we said, talking to the patient, getting good history of physical, finding out what are their complaints, what are their symptoms, what's their sleep history been, what do they think it is. More times than not, you want to talk to a family member who sees them sleep or hears them sleep. But ultimately, they're doomed for a sleep study, which is actually, you go to a sleep lab, you spend the night, they hook you up to a bunch of wires looking at your pulse, your oxygen rates, and monitor your sleeping overnight and decide if you have those pauses in your breathing. Complications, if we have sleep apnea, why do we worry about it? Why do we have to do anything about it? Hypertension is probably the #1 complication from sleep apnea, particularly in patients who you kind of go through the normal motions of trying to treat their hypertension and they're just not responding. You want to look for other causes that could be playing in that. Atrial fibrillation has been a big one in the last 5 to 10 years, realizing that it's a significant increase in atrial fibrillation, the heart rhythm that is abnormal. Heart failure itself, having a sleep apnea puts increased pressure in the vascular system and can kind of back things up on the heart, making it harder for the heart to pump. cardiovascular disease in general. This is listed as a complication, but when treated, interestingly enough, it doesn't seem to decrease the risk. So the correlation between heart attack and stroke is there, but how it fits in isn't really clear. Accidents, this is both car accidents, people are getting dozy, drowsy as they're driving, but also work accidents. People just aren't as attentive, they're kind of zoning out because they're so tired, and accidents are big with sleep apnea. Alzheimer's is, again, another one that's a little bit unclear, but there does seem to be beta amyloid deposition in people with sleep apnea, which is one of the big markers for Alzheimer's disease. So there is a lot of ongoing research as to the relationship between that and sleep apnea. Treatment, number one most common thing is lifestyle modifications. Losing weight, that's the biggie. Quit smoking, stop drinking. But really, most patients, if obesity is their real trigger, if they get the weight down, their symptoms will improve dramatically, their sleep will improve dramatically. Laying on your back is a much bigger risk for having obstructive sleep apnea or aggravating the obstructive sleep apnea, so changing the sleep position. Years ago, I used to recommend, I don't know if you ever recommended this, sewing the tennis ball on the back of your pajamas.
No.
So you get a square of fabric, and you sew the tennis ball inside the fabric on their back of their pajama shirt. And when they roll onto their back, it's uncomfortable. They don't really wake up, but they'll roll off it and onto the side. I recommended it a few times. Nobody ever does it. But nobody likes the CPAP either. So CPAP is continuous positive airway pressure. You get fitted for a mask, different types of masks, but essentially you wear a mask over your mouth and nose, and it's blowing a continuous airway pressure to keep that airway open so you breathe easier. There's also BiPAP, which does 2 pressures. If you get into high pressure CPAP, the patient really, it's tough to tolerate. But BiPAP is a higher pressure when they breathe in, lower pressure when they're trying to breathe out. If patients can tolerate CPAP, I've got many people who just, it's life-changing for them. More energy, they feel better, they won't go on vacation without a CPAP machine. But it's tough to tolerate. A lot of patients just give up on it. If they can't tolerate it, you move on to an oral appliance. It's a fitting for a kind of like a bite guard that shifts the jaw a little bit more out of line, opens up a little more space in the back of the throat. Surgery, get ENT oftentimes likes to go in and remove your tonsils, cut the uvula out, you can cut part of the soft palate out in the back of your throat.
You know, that's a horrible.
Oh my gosh.
Actually, my son had, we have it. It's
Sounds
awful.
That's what
And
everybody
I don't
says.
even know if they do them anymore.
Oh, yeah.
Do they still do them?
Yeah, not as often as they used to.
I wouldn't let anybody have that because I've seen it, it's,
Terribly painful.
oh, the surgery's awful.
Very ineffective for the most
But it
part.
doesn't work.
Yeah, yeah.
It
Because
doesn't
again,
work.
it's usually more of a further back obstructive problem with the airway
Oh,
itself.
Painful.
So
Surgery is terrible.
It's very rare that does any big
Good.
positivity to it. Implantable devices are kind of getting much more popular. There's 2 in particular. There's one that, for the central sleep apnea, actually, the electrode goes to the phrenic nerve and actually triggers the diaphragm to take the breath. And then there is a Aspire, is the big one that's really been marketed a lot. Goes to the hypoglossal nerve to trigger the back of the throat and the tongue to contract or open up the back of the airway and pull the tongue forward as you start to take that breath in. Pretty effective, but it's a pretty niche target who benefits from it. So it's not everybody that will qualify for either of those devices.
Implantable, where is it implanted?
It's on TV.
I
They have it on
see-
TV.
I saw the
Yeah.
commercial, but I don't know where the device goes.
So they put a battery pack in your abdomen, under the muscle in the abdomen, run the wire up to the back of the throat, and you're basically getting a little electrical shock to that nerve that then triggers the muscle contraction.
Only if
Every
they
time-
cut the
and
belly
it-
off in
And
the
it's
beat.
linked to your breath, so as you start to try to take a deep breath in, it triggers that muscle contraction. And,
I don't
pretty
know
effective.
anybody that's had it, but the one, they show on TV, the one is up here in the chest.
In their chest, I think
Yeah.
it's surgical.
I don't know.
Preference.
Wow.
I don't know how
Wow,
they do it or.
I've had a couple people do it, and they like it, but the majority of the people I send to get, when they can't tolerate the CPAP, the majority of people I send for an ENT evaluation, they don't qualify. It's very specific for who kinda gotta be that big tongue and relaxing the tongue as opposed to the airway. Because it's really, the biggest effect is on pulling that tongue forward out of the back of the throat.
Oh, okay.
Dr. Dunaway, I know you said that most people who are obese have it, but over the years, I've met so many people who are fit, of a regular, I guess you could say, a normal weight, that have sleep apnea. And so I'm very curious, what causes that? Is it, what can we do to prevent it as well?
Oh, preventable.
Yeah, if you're talking about a, like family history, they have something genetic that isn't passed on, probably not much you can do to prevent it. The vast majority of people who do have sleep apnea, it's the weight and obesity. So keeping a lifestyle that's active and good nutrition and keeping the weight in check, those are the biggest things you can do for prevention.
What happened, I remember when I was in university seeing a sign for sleep apnea, I remember paying very close attention, that was something new, I'd never heard about it before. But now it's so common.
Yeah.
Almost everybody has it, like, my neighbors, from my parents, like, everybody.
That's because everybody comes in and says they're tired. You say, oh, God, you gotta have a sleep test. There for a while, now, I haven't been in practice for a while, but God, when I was in practice there for a while, it like, everybody that came in, wanted a sleep test, and I think the pulmonologists do them, don't they?
They do.
And they're happy to do them. I mean,
It does seem like if you
The
send
advertising.
somebody for a test,
they're gonna come back with
it's very rare that they come back totally normal.
Okay.
They oftentimes will come back with some version of mild that doesn't even need
Yeah.
treatment or a CPAP, but yeah, I do think that still needs to be teased out a little bit as to what really is problematic sleep apnea versus snoring versus, I think it is all the rage in the last 5 to 10 years, you'd say. Particularly the cardiologists all love them because of the AFib and heart disease. They send everybody for them too. And it's probably a diagnosis that of the people who really get affected by it, we're not getting them all. We're not studying enough, but we're also probably way over-diagnosing a lot of somewhat normal people or people who aren't really going to have complications from it. And I think that's going to take quite a while yet to kind of figure out who should we really be treating and who should we not. And fatigue is a big one because there's so many reasons for fatigue, and I'm tired.
Well,
all day.
that's right, people would
From
come in, I'm
obesity
tired,
itself
the first thing you say, well,
to
how do you
just
sleep?
stress
Well,
of
I don't
life
sleep
and
well.
poor sleep and, so yeah, yeah.
What was prematurity for the, what happens there? You said one was prematurity, like for.
For a newborn,
Well, that's
that's
for
born
newborns.
premature.
Yeah, so-
Just brain development, because
Okay.
that's a central sleep apnea.
Okay, okay.
So the brain development isn't there fully yet, and therefore they're at higher risk for that. The brain just not sending the signal while they're asleep. When you're awake, they do fine, but when they get into that deep sleep and relaxation, the brain's just not triggering frequently enough to take the breath.
Gotcha.
Thank you.
Sure.
Okay, is there any more discussion? All right, so the next item on our agenda, looks like we're calling old business or unfinished business?
Yeah, you'll usually see on the agenda old business, we keep FAB on there, that's the public health accreditation that we received because we are continuing to work on accreditation throughout the whole, I guess, lifetime of the health departments from here on out, pretty much. And so they like to see records of that. We're speaking of FAB, and they'll look at the packet. And if you all recall, last year, we were working on our first annual report for FAB. And I told you we completed it. It was due in January. We completed it December 7th or something. And here's the response to the report that's in the packet. So that's just bringing to attention our FAB, process or activities.
All right, and next on the agenda is tobacco 21.
Yes, unless Carla has something else, we are giving information to the city manager for him to see if the new council has the appetite for capping tobacco 21 facilities. So that's in the process. When that happens, we've already done everything we need to do here. Carla can give you the update on how many facilities have paid and et cetera. But as far as the process of the capping piece, to be continued, but we'll let you know when it
How
goes to
many
the
months
city
is that
council.
then? What are they, is this how government goes? I mean, it takes
I
months
think
and
they-
months and months, and what are they doing?
Like me, yes. But no, I mean, the part of the capping part, we are waiting for new council to come on board. So we're, he's gonna get that presentation to the new council. And then Carla, how many applications?
We have 47 out of 6970 have paid. So we've on now a third of notice. We're hand delivering the notices again, and Amanda's calling them as well.
How long do they have?
Well, to what? Pay?
Yeah, or
They
do
should've-
they should,
they
most of
should've
they should
paid-
be out of business.
They should have paid by
There's no
December 31st.
way to get rid of them.
Yeah.
So they should have paid by December 31st. What happens if
Well, this is.
Nothing.
they're?
Well, since it's a new program,
Right.
we're kind of giving them the leniency of initially trying to get them in the process of getting licenses. Some said they didn't get the notification, although this is our third or fourth notice, so.
So you're hand delivering
We are
this
hand
notice?
delivering the notice,
Wow.
yes. The third notice, yes, third notice. As well as Amanda's calling, and after if they don't pay, then I'll, talk with the prosecutor on how to move forward for operating without a license.
Okay, we're taking step by step.
Step by step, yeah.
Is there any more discussion? Seeing none, okay. Next item on the agenda is new business, starting with travel authorizations.
I do not think we have any this month. So no travel authorization. That's always, item number one, just in case.
All right, so next, on number two, is review of the ODH medical, or I'm sorry, Medicaid administrative claiming, did you just call it MAC?
Yeah, MAC. The MAC billing,
Yeah.
it's Medicaid billing. The state of Ohio gives health departments money if they're a part of this program, anytime we do anything that, spurs Medicaid activity. So our BCMH, when we refer people to BCMH, if we refer people to CenterPoint or Primary Health Solutions because they don't have insurance, if we refer people to treatment through Medicaid, and so that's what this is. This contract comes every year. So it's just a review, and if you bill, you get paid. If you don't bill, you don't get paid. It's basically all the activities that's on it, yeah. And it's a long contract.
Boy,
Yes.
did somebody actually read this?
Yeah, I did the first time.
One time, okay.
Yeah, we do send all of our contracts to the legal department,
Okay.
so, yeah.
Yeah,
So
noticed that.
they read it. It's a lot of stuff in there that you don't understand, but we do.
It is interesting.
Mhm.
All right, so any discussion, more discussion on that? No? Seeing none, all right, we'll move on to the next one, 2024 election of President Pro Tem.
This is the time that someone is elected for President Pro Tem. I think Jeff, you're good still, Jeff? Yay! So, somebody can make a motion for Jeff Bonnell to be.
So moved.
Bruce?
Is there, having properly been moved and seconded, we'll go ahead and vote. All those in favor of Ms. Bonnell to be the President Pro Tem, please say yes.
Yeah.
Any opposed, please say no. All right, so the yeses have it, and motion passes. Thank you. All right, so next on the agenda, we're looking at the 2024 Board of Health roster.
Yes, this is done every year as well. This is the roster that you guys should have received. I can pass this around if you guys wanna double check it, or if you've already checked it, but it's just your information, on here, your address, phone number. Be reminded, I'd love to have cell phone numbers, because if it's something going on where the building's closed, or something happens, or emergency, I will text you all at one text. Otherwise, it's just good to have it for everybody else, just in case you need anything. So it came in your packet. If you need another one, let us know. The hard copy is here. And if everybody thinks their information is pretty much correct, I'm looking. Yep, okay, check, good. That's it.
All right, thank you. The next item is the 2024 Board of Health committees.
Yes, and Amanda put in the packet the 2023 committees, and I think everybody everybody can stay exactly the way they are, because there's no new members other than the mayor, and the mayor serves on both committees. And so, unless you guys wanna change, do something different, we have the personnel and the finance committee. So, you guys good with that? We'll keep the committees, or, you good? Good.
Next, well, okay, next, looking at the 2023 fourth quarter report.
Fourth quarter report, again, is in the packet. It just gives you your total of all of our environmental vital stat totals, and it's in the report. If you have any questions about anything, if you notice anything alarming that you wanna bring to our attention, you can let us know. Overdose were down this year. It looked like they were up because we had a lot of them, but they were down this year compared to previous years.
Do you know numbers?
Yes, I did have them. Did you have the numbers? I had them I had
I think it was
a
in
mental
here,
health.
wasn't it?
Was it? I had a mental health report. I don't know if Amanda compared them to.
Drug overdoses total for this year is 29.
Did
Or
you
I'm
put-
sorry, that was for 2023, yeah, that was.
Mhm.
And then for 22,
Is it in?
it was 51, so it's down from 51 to 29.
I do believe suicides were up. I think when I was talking to mental health board, we were on this call, I think suicides were up.
It was 8 this year and 5 last year.
Yeah, so suicides were up, overdoses were down, so. The mental health board, we were looking for the county, we were talking citywide too, but countywide too, and they were
Kinda
speaking.
interesting how the births and the deaths are almost equal.
Sadly,
That's kinda,
yeah, sadly, cause you want more birth
Yeah, right.
than death to keep your population. Yeah, so, yeah, that was one of the things that we're looking at, we're seeing more death and less birth. I mean, so over the years, we
That's-
keep saying the population
that's
keeps going.
nationwide.
And it's attributed to overdose, pretty much. I mean, you can get chronic illness and stuff too, but when you have all the, when they call accidental deaths, so suicides, overdoses, car accidents, things like that, if it's in gunshots, you know, like, what do you call, gun violence and stuff, those kind of things just wreaks havoc on your, you know, life expectancy and population. And another sad thing about that, we'll always bring it back here, is usually that population is childbearing, that population are young adults that have young children, so often it, you know, it has that ripple effect in the whole, quality of life issues and trauma and stress and drug, what do you call it, when you have to be into like mental health stability and drug treatment, because with all that trauma, it tends to not only be hereditary sometimes when you have it in there with alcoholism or whatever, but it's environmental hereditary. You know what I mean? It kind of constantly keeps going through family after family after family. When you'll see suicides in a family, you'll see multiple suicides in a family because it's a acceptable way of dealing with things. So sometimes they'd say suicide is not genetic, but lifestyle, behavior can be genetic. That's what you see in your family. So those are the kind of things that we always talk about, quality of life being important, especially in public health and prevention, because those are the kind of things that, quote unquote, you can't treat unless you start doing preventive things in that area. You know how that is, so. I mean, it's just unfortunate when you look at it. I look at a lot of our overdoses in their 30s. Amanda, weren't they really young this year, 30s? We had 20s, 30s, 40s, and if they have babies at home and family members that are all in that stressful situation, is just really, really sad.
Is it true, and forgive me, I don't know this, but is it true that because of the opioid epidemic that has happened, that we've actually lost the same amount of young people as a World War?
They had that count. You remember? I can get that information too. They had that count out because if you look at overdoses, when people kind of poo-poo it off or not think about it, it has, if you look at the life expectancy of individuals. So, yeah.
Because that would also affect births.
Yes,
That
it
whole
definitely.
generation of people who are not having children, who are not in the workforce.
Absolutely. Because when I look at those death certificates, I always, Amanda, I like the age. When you're talking about 30 and 40 and 50, that's your workforce. That's also your Social Security foundation or your retirement foundation. I mean, we're.
Well, but a lot of people aren't having kids.
Nope.
But a lot of women aren't getting married.
Yeah.
You know, I've watched they've had this whole stuff about men, you know, there's more women in college. You know, before, they always used to say teachers and nurses. You know, and now women are able to do whatever whatever they want and everything, and they find out they don't like a lot of these guys, or, you know, the men aren't keeping up with the women. I mean, they've done all these studies, so that's another reason why, you know, birth rate is down.
We
They're
can
not
go,
keeping up.
yeah, and we can go further to just the thought process. If we became more friendly with women, pregnant women, and childcare, we may want to have children as we work
Well, that's
around our
true. That's the other
masters
thing. I mean,
or our
it's,
doctors, but usually you have to wait to get things done, and so usually, I mean, yeah, so if we can, I mean, that whole environment, if you can, I mean, it's the whole mindset.
Well, childcare.
Childcare is the whole thing.
The economy affects the decision to reproduce as well.
Absolutely.
So it's all, yeah, there's a lot to it.
It's a lot to it, yeah, to change that whole structure. So we always talk about having families back and getting families back. We need to change the thought process of what does families look like and what do families need.
But they don't look the same.
They don't look the same, yeah. So, yeah, it's all interesting, and it's all, if you were to really get into, I mean, that would be the cool thing, to have the time to really get into all of it, because it's variables, but it all affects it, everything.
Any more discussion on that? All right, so thank you. And the next item, looks like it's just open discussion for board
Yes.
member topics.
Yes, and Mayor Nicole put this section in. We always, so this is just, if anybody has any burning desires to talk about anything or have any questions, or that's what this, area or time is, for open discussions about anything.
Anything at all? I have one thing.
Sure.
That I brought this book. I heard about this book on the radio, and I have an interest in, well, we talk about prevention. It's one of the big things for the Board of Health, and eating your veggies is important, eating natural foods and things like that, but also working out in gardens. And I was just wondering, like, this might be a possibility to try to make some connections with our children, the youth in the schools. Have you guys talked about or had that conversation of gardens at the schools or fruit trees at the schools? Has that been anything that's been
They've
talked about?
had some of that, haven't they, where they, around town, and
Yeah.
where they did some gardens? or did-
They've done gardens. The Middletown Connect Committee
Mhm.
did the gardens over there in Sherman Park area, like on Cleveland, they helped put that garden together. They want to put gardens throughout the community, wherever there were vacant lots, to turn them into them, to teach kids and the neighborhoods to come together and get fresh produce in those areas. It's a little process, and it's kind of sticky, because you wanna make sure that they keep them maintained or whatever. So we were talking about Guardians of the Garden, and we were talking about having money from USDA, there are grants out there to help.
Mhm.
So there are discussions, but yet again, when you guys have your strategic planning or whatever, it's a lot of things that have teeth. I mean, not, we call it, there's that they mention, but it's no teeth to it, it's no money behind it, it's no who's gonna be in control of those things. But yes, there are a lot of good programs. I know it's one in Detroit where this whole blighted area, this woman did gardening and had the neighborhood kids, and she was showing them about the soil and planting the seed and then picking the tomatoes or whatever, and the kids were coming and she was teaching about that. And it was a safe, wonderful place to come, and they were learning all about not only nutrition, but how, how to garden and where things come from, just not Kroger's. And so it was really interesting, so.
This book
yes.
is called The Garden Next Door, and it's cute and it's inspiring, and I feel like something, you're right, it would have to be multi kind of, could we talk to the schools, could we talk, and then we talk to council, and we look at what's possible to do a program. So, we can read a book, but then also inspiring, because it connects everything. This gets people outside, getting your hands in the soil is important. They've linked that with mental health, and so it could be multifunctional, multifaceted.
Absolutely.
But just a thought, I'm wondering how that would work with the health board. Where would the health board fit in with something like this? If we all came together to move it forward, and just see what might happen. Especially if the schools are involved, because then it can be a classroom kind of thing.
Discussion, yeah.
Exactly, and maybe kept up. And I don't know what that looks like, but I thought I'd just mention it.
It would be good to have some prevention built into that. But,
Yeah, and fun, and it's fun.
Yeah.
And it's beautification.
It's beautification, yeah.
It's all connected. And then they eat their own vegetables, they're so proud, and it's just,
Mhm.
it's all connected.
Yes.
Thank you. Is there else to bring up under open discussion? Okay, nothing, so we're finished with that. So the next item on the agenda are reports.
Yes.
From the health commissioner.
Yeah, the biggest thing, I have some copies, and I can send them out electronically to y'all, but some community events that's going on. So this is some MLK event things that are going on, a Dream Keepers Film Festival. This is about the PIT count. PIT is point in time count, it's the homeless count. And so this is coming up the 23rd through the 24th. What was really interesting, Mayor and I are serving on this housing homeless kind of coalition committee, and Commissioner Carpenter thought, why don't we do a big dinner instead of going out into the elements and the cold under the bridges or whatever? But if we did this big dinner in all the cities, everybody has a point where they have a big dinner and they come in, they can feed them, and then you can count them then and get more information and give them more resources. Would that be better? Because sometimes this is done in the coldest day of the year, and usually everybody's housed. You can't really find people then, it's just the diehards that you find. So to be continued, because they think Butler County is undercounted, and they also think that we could receive more money if we come up with a better count. And then the schools talk about this, we're not counting all the people that are homeless that are housed. A lot of school people said the kids are not at their old residence. They're in Cincinnati. One said they're over there in, what's that, casino area in Indiana, something, what is it?
No.
That-
Lawrenceburg.
Lawrenceburg, yeah. They're over there, but they bus them in. They said $300 a day. They were talking about the cost of all of this, how the kids are misplaced, but if they're still in your school system, you probably know about this, some of the things, I don't know if Madison has that big of a problem, but Hamilton talks about it, Middletown upstairs talks about it, where if they're still in Middletown system, they still count, and you have to pay for their transportation. It was something that President Reagan put in place, that you know, every kid gets that transportation, so they're using UTS, Ubers, they're using all, it's just a lot of money where these kids, when they're homeless. I mean, when they're misplaced, but they can still be Middletown City or Hamilton City schools. So anyway, we're trying to do any more, Mayor, that you wanna add with this? We're trying to.
Yes, I'd love to actually talk about it, and I'd love to go back to
Yes.
the movie. Could we announce
Yep.
the day, time?
Oh,
and
yes, the
location?
daytime, you're invited to the Dream Keepers Film Festival. It is on January 15th, so it's actually on MLK Day at 1 PM. It's free, and it's gonna be at the Sword. And it's, and so like I said, I can send this out, here's some hard copies, but I can send this out to you.
And it's Selma that will be watching. Also, is there
Yes.
a parade? I believe there's a parade at noon on that day, is that correct?
Yes, and it used to always be a parade. We're looking to see when it is. I know Hamilton, Oxford, everybody has one. I'll get that information. That parade usually kind of starts anywhere in town at different churches, so I'll make sure we have an updated place. Do you have the?
From what I've seen, I think it starts at Governor Square, but I'm not
Okay.
positive. But I think that's where it starts this
Where
year.
it starts this
I
year?
will check too. Talking about the point in time count, so that happens, it starts at, has anybody ever done it? Has anybody ever done it? It starts at, I believe, 8 PM on the 23rd, and it goes all night to 6 AM. And what we're doing is, we're looking, the state, you know, all 88 counties, when you go and look at continuums of care, most of the bigger cities have them, and then you have the balance of state. So Butler, we are in the balance of state, but we're looking at maybe having our own, talking about funding. But as the health commissioner was talking about, sometimes you can get, funding is connected to the point in time count. And because it happens during one of the coldest days of the year, most people are trying to find a safer place to sleep. But these directives come down from HUD, so there's not much we can do. However, one of the things we are looking at with I think we're kind of calling it the Butler County Homelessness Work Group. It's a lot of Butler County people looking into what we might be able to do across the county. And we're looking at the possibility of having another count. We still have to do the point in time count, the official one in January, but we're also looking at one in the summer when more people are out, plus including maybe people who are in motels, people in garages, people sleeping, that kind of thing. You do have to go to the people though. So they have to be sleeping outside to be counted. so that's one of the items. But we do need volunteers for that to try to get the most effective and efficient count. And so that is something, if you're interested, there is contact information here with Alexis McKee at Community Health Alliance. But yes, that conversation's ongoing. We're looking to see if we can get more accurate counts of what we're actually looking at and what we're actually dealing with. Because I believe, and I could be wrong, but I think one year it was stated that we had 217 homeless people in Butler County. And that doesn't make sense with what we see even in Middletown. And again, I could be incorrect, but that's what I've heard. So it does look like we could do some tweaking here, and we're in conversations with the state as well to do, to maybe change some things, at least to see how it goes for Butler County.
Yes. Some of the systems just need to be tightened up. It's a lot of HUD money, and it's a lot of different housing definitions.
Mhm.
You know, low income housing or low moderate housing or whatever, and it's just a lot of money, and we're just trying to make better use of it.
And we're also looking at something that we could possibly do county-wide as well. Because I know one of the concerns is, you mentioned at the last meeting, it's, we don't want it to just be Middletown, and it's everywhere. So it's that conversation of how can we come together as a county to address an issue that will not go away. We're always gonna have people on the edge, children aging out of foster care, people getting out of relationships, losing jobs, check to check. So this is something that's all on the spectrum. So we're looking at this as a place to start. Any other discussion on that?
Just putting in there with the housing market too. So, low-income parents, single parents, et cetera, they really can't afford rent. All the rent is $1,800 a month, even in, poor neighborhood or whatever, at poor neighborhoods or whatever, and
You
so.
also
in-
have, re-entry from prison.
Yeah.
A lot
Right.
of people can't get homes,
Mhm.
or, well, not homes, but even apartments.
So-
Because of renters.
So they're looking at they're trying to look into all of that.
Yeah, it's a long, it looks like it's a lot, but the work has been started in Butler County, which is very inspiring to know. And in fact, we have a meeting today at 1 o'clock. And so we keep going,
Last but not least, this is in your packet, and it's in the back of your article, but I made copies as well. This is our schedule for our shelters, and Shalom is on here too, and it's supposed to be really cold this week, and so this is, we're gonna post this on our website, on the city's website, but this is out there, what churches are housing the Shalom, but it is in the back of your packet. In the very back, it was the article that was, hold on just a second. Not the marijuana article. It was the one that talks about shelter struggle, this one right here, and it's in the very back where it's all of the listed information as well. So you can keep that one, or here's another one you guys can have if you want it, so. It's just in the back of the article that says it, so we'll have it electronically as well, so. What we're being overwhelmed with is, as you know, Janae left going to Hamilton City for Assistant Health Commissioner, and Laura resigned and she went to tax. Laura Brown, it was the Deputy Vital Stat Register. So we're down 2 staff people, and we're trying to interview. We received like 2 sanitarian applications, and the rest of them are students or people with bachelor's and master's in biology or some science that we're looking through. So as you know, I keep informing people that the health department staff is usually specialized. So it's hard, you wanna keep it like, you wanna keep the wage competitive, cause it's hard. When you lose one of your sanitarians that does all the inspections, it is very hard to get another one. Every health department are needing them, right? I mean, you constantly can see every health department hiring environmental health specialists. So that is the opening. Carla and I have 3 other 3 other interviews. Again, they're not sanitarians, so they would be like Sarah. They would be sanitarians in training, which means that we would have to start the process of a 4-month training process. Sarah now, Carla said she's probably about 80%, 85% trained in, because you have to train them in every program, tattoo, pools, stores, restaurants, the whole gambit, septic and whatever. And so now Carla is being pulled back into the field inspections, doing inspections, and she also has a pending, she needs knee surgery, so we're trying to work around that. Because she's trying to find her, her slowest period and when she can train and how long she would be out of commission, if we will, so to be continued. And it takes a lot sometimes just to start being in the office interviewing all day. As well as now we're gonna take Laura's position and change it into administrative assistant so that we can have her do like pretty much everything and support everything. And we have about this big of a stack for, administrative assistants, which is yay. We got 1, 2, 3, and we can kind of narrow it down.
Spanish speaking?
But that's what I really am trying to lean, and I've spoken with our mayor, I've spoken with Alexandria, I've spoken with the schools, I've spoken with Miami University, hoping to get, spoken to other people that know other people to try to do that, so we wanna make sure if we have the opportunity to hire, we should do it, because it is very, 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 very difficult to speak to somebody in Spanish with food trucks and with babies being born, and Chandra has, the infectious disease when she was trying to communicate. It would just make a lot of sense, right? So that's what we'll be doing for the next couple of weeks probably. We'll be looking at that, doing that, so we've been doing that.
I was thinking, I think even when we were speaking, like, my Spanish is not great. It's all right. If I'm does anything ever happen here where you need a translator? If that happens, if I'm here, if I can come down, yeah, please come and get me. My office is down in the hall, the clerk of the council. But again, I could learn some of the words that are important for each situation, and that will help. But if I'm here, I've done it before in other places, so it can be helpful, even though my Spanish is limited.
And I was thinking, I was telling the city manager and stuff, just for us to get some knowledge of it, to be at least more customer friendly, you know what I mean? Because all of a sudden, if you say one thing, like I tease, but if I say hola, people gravitate to you, because it's like somebody knows. I was caught in the garage down in Hamilton doing a lot of different stuff, because they thought, oh, she knows how, I'm like, hey, it was like,
one word.
yeah, it was like, I can say no and poquito, but anyway. But yeah, it would definitely help. Plus, I think it's what we need to do. I mean, if we're doing business, we should be able to be business friendly with all of them. People love to say, oh, you can use the phone to interpret it, but Carla uses that. Yeah.
It's better than nothing.
Yeah, it's better than nothing,
It
but
really is.
we just get louder and talk slower.
Well, I also saw, I think in the contract for the local health department, I think it does say offering
Yeah.
language help, so
Yes.
it's part of what we need to do.
Right, and we do it, and the courts do it, but it's usually always a system that you have to call up, or it's an app, or it's, instead of having that, you know what I mean? Especially when you know it's not a one-off, you know it's gonna be a customer of yours, so you should be able to, you know what I mean?
And in times of stress, it's so helpful.
It's true.
And even like when somebody is, just thinking about this, like, I come from a multicultural family as well, and I think to myself, if something were to happen, they all speak English beautifully and perfectly, but if something were to happen, and maybe they're out of it, what if they reverted back to their.
Reverts right back to.
Right, and they're just not, and being able to communicate, would be so important and meaningful in that moment.
Yeah, yes. So we have Alexandria that helps us as well, like when we do, Chandra keeps her own contract. If we need anything, if we need clinics, if we went to a pantry to do shots or whatever, she's always available to help us. But we just need, I would love to be able to find her, so if you guys know anyone. That's about it, that's all I have.
Okay, so that's it now. Any other reports from the medical director?
Medical director was the reportable diseases for the month of December. We had 24 chlamydia, 10 gonorrhea, 7 hepatitis C, 2 hepatitis B, 3 pertussis, one syphilis, and that is really pretty much all of the major illnesses.
Any discussion on that? Seems that, just looking at the numbers, right, is that, I'm not familiar, is that normal, is that rate of chlamydia, is that normal? See, that was like the highest one at the place.
Yeah, chlamydia usually is the highest, and those are all pretty typical numbers.
Pretty typical.
Yeah.
And, what can we do to?
Nothing.
Nothing, okay. All right.
Education.
Oh, okay, okay.
That's basically it, correct?
Yes.
Okay, and we're doing that, so.
Trying.
Trying, okay. What could we do better? Really though, to have that conversation, is there anything that we could do better?
I think a lot is done, and you know, you can always do things better, but I think a lot of time and money is spent trying to educate, and I think there are people who just don't think it's going to happen to them, or that's not a priority for them to worry about at the time. So it's hard to get that number down to 0.
The blessing box had a box of condoms in it, and the church said, does the health department want them because they didn't want to put condoms in the blessing box? We run into those kind of things too. I ignored that phone call, so if you. Do you guys need condoms? I'm like, they probably got them from us. I'm just kidding, no. But somebody put them in the blessing box. I'm like, yeah. Along with the canned goods.
That's rough, yeah. Okay, so, Director of Nursing, report?
Okay, so last month was definitely a respiratory illness month for, pretty much the nation. We did have cases of RSV, which are not a reportable disease. That's included on those lists. It's just not to that level unless there's an outbreak. They were unrelated cases, but they were reported to us nonetheless by providers. Our hospitalizations were, mentioned in the report. Those are for flu. Those are the only ones that are required to be reported to us. But again, we have great healthcare partners, and they will report even non-hospitalized cases. So our numbers were up. For the vast majority, when I look, they're unvaccinated adults and children. We did have a couple of kids. So I will say this my entire career: get your flu vaccine. Even if you don't think it's going to affect you, you getting sick can affect so many other people. So you got to think about those high risk individuals. So that's my flu soapbox. We do have the vaccine available, so if anybody's interested, they can come and see me. I'm happy to give it. So my next discussion is just a reminder. We talked about it last month. The eclipse is coming in April. We are in that path of totality, so we get to see all the darkness. If the weather is permitting, we'll be able to see the eclipse. Over the next couple of months, we will be kind of putting out information for schools, for businesses, funeral homes. I actually got asked, why do we need to put something out for funeral homes? Well, because you might not want to get stuck in traffic with a funeral during an eclipse. And they're like, oh, well, that makes sense. So we'll be putting out information on our website and into the community with our partners leading up to the eclipse. And then just one event coming up for disaster preparedness. Since I am the emergency response coordinator for our preparedness for the department, one of the responsibilities is to participate in exercises throughout the region. There is going to be a chemical emergency surge tabletop in February, so I'll be participating in that. So I think it comes on the 14th, so it'll be after the next board meeting, but I will kind of give you guys some information about how that pans out. It's with the hospital systems primarily, so it's going to be an interesting, it's about 4 hours long, so it'll be an interesting exercise. That does it for me.
Yeah, I was gonna say, reminder, Janae was doing the emergency preparedness, so we've split up duties, and we're splitting up Laura's duties too, so all of us have a little piece of them as far as in the duty, and Chandra's doing the emergency preparedness.
All right, thank you. And now from the Environmental Health Director.
We've approved, 4 sets of plans, for facilities, Middletown Common, Grounds Coffee Shop, which is at the schools, Middletown High School, Summit Academy, one of their buildings decided they wanted to go back and serve, food, so we, Building B, which is on Manchester, we approved them, and Lakeside Inn is planning to reopen as a bar, so we approved the plans, for them as well. We've, received plans for a smoothie bar, which is out on Pendleton Circle. It's called Irie Smoothie Bar, so looking at that. We actually closed 3 mobile food service operations last month. 3 were operating without water, and 2, they were operating without a license. So, we're trying to make sure that, when the mobiles, 2 of those mobiles weren't, well, 2 of them were in Middletown, 1 wasn't, from another jurisdiction. We're just making sure that when we see new mobiles come into the city, that we do inspect them. A lot of them we do see at events, but if we don't see them at events, we wanna make sure that we at least stop and make sure that they have a current license and running water and all of that. We're only required to inspect mobiles once a year, but we just need to make sure that they're on our radar to look at them when we see them in the city.
Can you inspect more often than one
We
year?
can, yes, we can inspect. And, Sarah and I just continuing with, inspections. Our license year ends, in, February, so we're just on target to complete our inspections. So, that's it.
Any more discussion? All right, wonderful. Well, if that is all, then it looks like we can officially adjourn, this meeting at 8:33 a.m. until our next meeting, which is going to be on February
13th, it should be at the bottom of your agenda.
Oh, there we go, yes, February 13th at, 2024 at 7:30 a.m. back here in 2C. Thank you, everybody.
Thank you.